Hi, everybody, and thanks again for joining today's webinar. I'm going to get things kicked off now, and we may have a few people join as we're going, but just to let all of you know that this webinar will be recorded, and we will be emailing all registrants a copy of the slide deck that we are presenting with. So any information that we don't spend enough time on that page for you to absorb it all, we will be forwarding all of this information to each of you directly, so at your leisure you'd be able to review it. I'd like to start first by introducing myself. My name is Adam Lombardi, and I am the Director of Sales and Business Development here at Amazing Charts. My role, obviously, with the sales department is overseeing all of our account managers and sales executives, who I would imagine most of you have dealt with either recently or in the past when you joined our community. Today our focus is going to be on Amazing Charts practice management and how it can increase the productivity and your office workflow. We'll be going over a little bit of the PM overview, and then I'll be passing along the controls to Katie, who will be going over a product demonstration and a little bit of a deeper dive. I want to be upfront in telling you that this will be a high-level overview of the product, and if you or any of your staff members would like a deeper dive and perhaps a one-on-one dedicated demonstration of the product for you and the way that you would need to use it, you can feel free to reach out to our sales department, and we would be able to schedule that with our practice management sales specialist for you. So the background of Amazing Charts practice management, to let you know where it originated. For years, obviously, our EHR has been rated as one of, if not the top electronic health record systems on the market. We just recently got the #1 ranking again from WebMD and Medscape. And also, along with our ranking being so high, we have prided ourselves on the fact that our pricing model is set at the lower end of the spectrum. So when we sought to create a practice management and reduce the double entry that does sometimes occur with an interface product, we needed to keep that target in mind. We needed to find a way to make the product very functional and easy to use so it would not contradict the way that our electronic health record is received in the industry, and also a way to keep that pricing model in line with our electronic health record system so you don't find yourself with an affordable solution on one side and something that breaks the bank on the other. We've done a lot of research comparing market analysis from other companies and the products offered, and we've made it a point to find ourselves just below the pricing of all of our competitors to make it easier for you to incorporate this type of a solution in your practice without hurting your wallet. As far as who should be using Amazing Charts practice management, just so we understand, this is a software and it's not a service. And in saying that, what I mean is that the practice management will give you the ability to electronically submit your claims through the clearinghouse and receive electronic payments. But it's still software. It won't be doing this on its own. You will need somebody at your office that has the capability and understanding of medical billing and or practice management software to efficiently use this. The idea that I like to give people is it's similar to a do-it-yourself project at home. We would provide you with the toolkit and some basic instructions and training, but from there, the lifting would be on your end as far as processing your claims efficiently and being able to follow up on claims that you may have issues with due to coding errors or human error with something that was entered incorrectly from your end. Okay, so eligibility is one of the basic things that practice management will provide for you. And with it being real-time eligibility, the benefit of that is you will be able to check a person's insurance eligibility when they come in and check in the office. So you know that that person that is there for today's encounter or today's visit, their insurance is valid, and that you're not going to run into any issues on having the claim reimbursement. If in fact it comes back as they are ineligible for insurance, it would give you ample time to discuss the options with the patient while they're in the office, possibly a pay out-of-pocket visit, whatever you may be able to offer from your practice. The customizable schedule is something that we made it a point to work in because over the years we've had many of our Amazing Charts users request if they could make any changes to the schedule, and a couple of the changes that they really wanted to try and incorporate had to do around color themes where they could have different color codes either per provider or per status of the visit. So now if you have a multiple provider office, you could set up one provider pink, one green, one blue, one yellow. So at a quick glance, you'd be able to tell who has which appointment coming up next. Another way that practices are choosing to use the color coordination is for the stage or status of the patient's visit. So they could use something like green that they're in the waiting room waiting to be seen. It could be orange that they're in the exam room, and it could be red that they're at the checkout. As far as data integration, this is one of the big benefits of choosing to go with an integrated product versus an interface product. The data integration, anything that you create a change in Amazing Charts or in Amazing Charts Practice Management, that change is going to be reflected in both places. You're not logging into two separate software products. You're logging into one. Where that's going to come into play compared to an interface product is if you have a patient that changes address. If you're using a third-party practice management, it would be your responsibility to make that address change in their demographics in both Amazing Charts, EHR, and the practice management that you're using from a third-party provider. With ours being seamless and integrated, all of those changes will happen in real time and will reduce your double entry that you are seeing today. As far as the clearinghouse that we use is Claim Remedy, and the clearinghouse is what gives you that ability to electronically submit these claims to all of the insurance payers and also be able to look through the portal of the clearinghouse and see what's going on with your claim status. So it'll give you real-time visibility into where your payments are in process and what you can expect to be receiving shortly. As far as the pricing, what you're going to notice at the top, Amazing Charts is priced by provider, and Amazing Charts Practice Management follows suit. So if you are in a single provider practice, you would pay $249 per month for the practice management. And I don't know if people have checked what other products range on the market. Most of them range from about $299 up to around $500 per provider per month. So like the Amazing Charts clinical side, we've targeted keeping the practice management side as one of the lowest priced options that's on the market for people. If you have a multiple provider practice, rather than charge you $249 each like most of our competition does, what we do is we charge individual providers $99 at that point. So a two-provider practice would pay $249 plus $99 plus $99 for each provider for a total of $447, which would be less than the $250 if we multiplied it by 2. And it goes up incrementally just like that. So a 3-provider practice would pay $249 plus $99 plus $99 plus $99 for a total of $546 a month. So a 3-provider practice is seeing a huge discount in comparison to what they'd find on the competitive market today for pricing. It's an annual subscription, so you would sign a contract and it would be a 12-month pay period. You would not start paying until you go through our implementation period. The implementation runs anywhere from 10 to 14 weeks, and that'll include helping you set up some of your tables, going over some training, getting your hands on it, making sure you're comfortable, getting your database all set up. You'll be assigned a one-on-one dedicated practice management implementation specialist that will basically hold your hand throughout this process, and they'll be your direct contact point. And then separate from our Amazing Charts Guardian Angel support, we also have an Amazing Charts practice management support. So once you do go live, there'll be a separate team that'll be available to support you on the fly if you have questions about how do I do something or how can I make this more efficient for myself. So with that, I'm going to pass this over to Katie, and I'm going to let her show you what the product looks like, which I'm sure is the important part for most of you guys. And as I mentioned, feel free to reach out to me with anything that you might need.
Thank you, Adam. Good afternoon, everyone, or it may still be morning for some of you. Thanks again for joining today. I do appreciate everyone taking the time out to join the demo today. So everyone should see my screen right now. I'm going to begin the presentation today in Amazing Charts, just to explain the pieces of the integration between Amazing Charts PM and AC. So when you go live on Amazing Charts Practice Management, you won't have to worry about logging in to a separate site to access the practice management. There will be links built right into the Amazing Charts product that would then allow you to easily navigate over to the practice management. There are numerous links, but the one that is most often used and obvious is located right on the main Amazing Charts screen up at the top here. So you can see in just a click, I was able to move over to the practice management side of the product. So all of your clinical data for your patient is going to remain in Amazing Charts. And Amazing Charts Practice Management will be the place that you manage your patient charts, scheduling, and of course the billing piece. And once you're over into the practice management, of course, there's probably going to be staff members that are going to need to go back and forth from the clinical area to the practice management system throughout the day. You'll notice down at the bottom here where my purple folder is located, I can easily toggle back and forth from Amazing Charts Practice Management to Amazing Charts and vice versa. So the three key pieces of the integration is the patient chart, the schedule, and the charge piece. So you can see here on the main AC screen, I have my schedule for the day. So for those staff members that are not going to necessarily need to go over to ACPM because they're the clinical staff, they will still be able to see all of the patients that are going to be coming in for the day. Because when an appointment is either scheduled or updated in Amazing Charts Practice Management by your front desk team, that information will be transmitted and updated in Amazing Charts. And then the provider, when they are going in to do the encounter for the patient in Amazing Charts, they would do a small piece of the coding. And this just allows for some of the information of the visit to transmit over to Amazing Charts Practice Management, so the biller could then do the rest of the coding, review the charge in its entirety to make sure that all of the necessary information has been entered for billing purposes, and then they'd be able to transmit the claim out of the practice management. So the provider would really just do some basic coding, select the level of the visit, and they would also be able to select additional CPT codes from the visit. And the quick codes area is customizable. So you'd actually be able to create an electronic version of your encounter form for your providers. And then really that's all the provider would need to do on their part. When they click the Sign It, it's going to trigger Amazing Charts to then take the details of that patient's visit and move it over to the practice management for billing purposes. And it happens pretty instantaneously. If I was to go over to the patient's chart right now in practice management, that visit would most likely be there. So I'm going to go over to the practice management now. So like AC, practice management also has a main screen, which is called the front desk. So the practice management was designed to really mimic the typical workflow in a practice. Over here on the left is where you'll have your view navigator, and this allows you to see where you're working in the product at all times. It'll highlight the link. So you can see in the front desk, this is where the front desk would be able to do pretty much all of their tasks throughout a given day. They wouldn't have to leave the front desk unless they maybe do some of the billing pieces of the system, but even with that, we do put a charge entry link and a payment entry link here for the front desk's convenience. If it is a smaller practice and you do have staff that do some of the billing as well as front desk activities. And there are different links available throughout the entire product because, again, we want everything to be available at your fingertips. Every practice has different workflow preferences, and of course some practices are smaller than others. So we want to make sure that you can get where you need to get to in the system very easily. And you'll be able to see all those different shortcuts and drop downs throughout the system as you navigate through. So you see here on the front desk, this is where you would search for an existing patient. And when you search for existing patients in our system, you have the ability to choose from a lot of different search options. Most people prefer to search by name, but you'll see all of the other options available to you. And when you do search for a patient, the system allows you to see some basic demographic information to ensure that you are selecting the correct patient to work with, because if you have patients with the same name, you may need to confirm some additional information before you start working in that patient's account. And you'll see here when I do launch into a patient's chart, the patient chart in ACPM is really information central for that patient. You can see at a glance what is going on with that patient as far as demographic information. And if something is missing, you'd easily be able to update that here accordingly. Their billing information, if they have co-payments or co-insurance responsibility, what their insurance balance is and patient balance is, their date of service history. And you can see here, this is where that charge information is going to pull over from Amazing Charts once the provider signs off. And here is this patient's charge that came over. It's all ready for the biller to come in, do the review process, make any necessary changes to it that may be necessary, and then transmit the claim to the clearinghouse for further processing. Billers would also have the ability to drop claims to paper on the fly if that was necessary. You can demand claims. Billers can track notes for the patient's visit, print receipts, and even make copies of a visit. You'll see here there is a patient alert section. So of course there are circumstances where you need everybody in the practice to be aware of something that's going on with that patient, whether it's from a demographic perspective or billing perspective. And you can actually set up these alerts in the system and color code them so that, you know, they're pretty obvious that when you log into the patient's chart that they need attention. You can see all patients' upcoming appointments and historical appointments from their chart. So this is really convenient if you need to see when the patient's last physical was, or how often they're missing appointments, which is no showing. And right from here, you could cancel or update an appointment. Prior authorizations and referrals can also be managed right from the patient's chart. And at a glance, you can see what is active and open. And if there are so many visits or there is a time frame allowed for an authorization or referral, you'd be able to see all of that from here. Amazing Charts Practice Management also has the ability to flag you when a certain referral or authorization is reaching its effective date, or expiration date, should I say, or if there's a certain amount of referrals or authorizations remaining. You can view and track recalls in the patient's chart. So a lot of systems have this capability. It may or may not be something you're familiar with, but recalls allows the practice to set up a appointment reminder that the patient needs to come in for a certain follow-up appointment within a given time frame without actually booking the appointment. So depending on how far in advance you book your appointments, if you don't book them out a year in advance, you could set up recalls for your yearly physicals. And then the front desk would be able to run reports and use a work area to manage these recalls and follow up with the patients accordingly, whether it be phone call, letter, postcard, etc. And you'd even be able to see if an appointment had been booked already and that recall has been fulfilled. And then also from the patient's chart, you can see their entire claim history. So when those different visits were submitted and what the status of those visits and claims are. And then lastly, the statement history. So anytime that you generate a statement for a patient, that statement gets logged in their chart. So if the patient called with questions regarding that statement, right from here, you'd be able to locate the statement date, see the amount of the statement, and actually view a copy of that statement and reprint it if necessary. So you can get all of your questions answered for a given patient by looking in their chart. Going back to the front desk, you can also register new patients here. So if you were done working with a specific patient's account and a new patient called, you could easily register them right from here. There are other links for patient registration in other areas. But right from here, I could click on it and do a registration. And you can see that all of the registration fields are available to you on the screen. But more often than not, clients want to do a mini registration or a quick registration, and the system does allow that. You could simply just put in the patient's name, gender, and date of birth, and save their account. And then when they come in for their appointment, you'd be able to get the rest of their information. But it does allow you to do a full reg or enter as much information as you would like at the time of the patient calling, if you wish to do so. Appointments. So you can see here on the front desk under Manage Appointments, this is where you can see all of the appointments for a given day. And depending on the size of your practice, how many providers you have or locations, you can filter this information to only look at appointments for particular resources at particular locations. And this allows you to see, by patient, the status of their appointment, have they checked in or checked out, the reason for their appointment, who they're seeing at what location and time, and then take actions on the different appointments. You can launch the chart from here, view the details of the appointment, check their eligibility. And Amazing Charts Practice Management allows you to do eligibility checks 2 different ways. You can do an automated electronic eligibility check or an on-the-spot check. So the automated electronic eligibility check would be for patients that are currently booked on the schedule. You can set up the system to either go out a day before the appointment or 2 days before the appointment and do a check with the payer to see if the insurance on the patient's chart is eligible. And if an automated check had been completed for a patient, you'll see in this last column here, it will show you the eligibility status. And then depending on whether that status was eligible or not eligible, you can drill in and get further details as to why was this patient considered eligible, or they were eligible. Now, what is some of their benefit information? Maybe I need to verify what their copayment is or their deductible, or see if a referral authorization is required. So as long as the payer sends back that information through the status, you would be able to get that additional information. And then the on-the-spot check would be used if the patient came in and you didn't originally have their insurance because they were a new patient, or when they came in for their appointment, their insurance needed to be updated, and you wanted to do a check on the fly with the patient right in front of you. You can click it right here and check it. You also can check it right from the patient's chart. So where you actually do the adding and updating of the insurance, you could also check the eligibility from here. And then you could actually mark a patient checked in for their appointment missed or seen from the Manage Appointment screen. And you'll see to the appointment book screen, there is another way that you can manage your appointments. This is really good from a basic check-in, check-out perspective, but of course, if you're going to be rescheduling appointments or booking follow-ups, you'll probably prefer the appointment book screen. And then down here is the outstanding recall work list area. So this is where you'd be able to see by appointment type who is past due for the recall and who is due within another time frame. And then you could actually drill in and manage the patient recalls. And like I noted before, you can either reach out to them via telephone number, telephone, letter, postcard, to let them know that it's time to call the office and make their appointment for whatever their recall was scheduled for. So then now if I go over here to the appointment scheduling link up here, it's going to launch me into the appointment book screen. So the appointment book screen, as you can see, is where you're able to actually take advantage of the customizations that you can do in Amazing Charts Practice Management. Not only do you customize a provider's schedule, but you can color code their headers. You can color code your slots, so your appointment slots that are available could be one color versus times that the provider cannot see patients, whether it be morning or lunch breaks. You can have that a different color. You can color code appointment types. So you can see here, my follow-up appointments are in blue, my sick visits are in teal, my new patients are in purple. You can also color code statuses. So once a patient is marked checked in, they could turn green, like Emily. Or if a patient missed their appointment and they were marked a no-show, they could show up in yellow, like Jessica. Or if they've checked out for their appointment, they would be red like Shelley. You can even color code eligibility statuses. So if eligibility is really critical for your practice, you could have all your patients that came back with a status of not eligible show up in a particular color on the schedule. Eligibility checks would also be noted with different icons. And if you did want to view the eligibility details or do a recheck for eligibility, that can be done right from the patient's appointment as well. You'll see here that you can also block and unblock providers' availability. So if a provider had a conference or is at a different location for the day or was taking a vacation, all of that can be noted. You can also customize views of the schedule, so your increments of your appointment slots. You can actually even customize the different views. So if you're a multi-doc practice or you have multiple resources, you could set it up so that you can have different views of your provider schedules. So you can see right here, I'm just looking at Dr. Deere and Dr. Johnson's schedule, but I could change my view to maybe just look at my medical assistant, Laura's schedule. Or if I have a flu clinic in my practice, I could change the view so I'm just looking at the patients that are coming in for my flu clinic. You also have the ability to book appointments a few different ways in the system. So you can use all of the navigation tools that we have to locate appointment, whether it be using the calendar to jump around to different days or our navigation buttons down at the bottom. Or our day views, you can actually look at a multiple day view for an individual provider. Or you can do a bulk search. You can actually put in a criteria and have the system really do all the work for you in looking for an appointment. And then when you do that bulk search and choose all of your specifications, and you can see here that I can get pretty specific as far as location, provider, slot size, date range, whether I want an AM or PM appointment, and even what time of the day, day preference, and even I can find reoccurrences, all using that bulk search. And then when you do a bulk search, the system will actually spit back the information right underneath the calendar. And you'd be able to jump to the different days and locate your appointment. Booking appointments are pretty straightforward. You just click on the slot size once you locate it, and you fill out the rest of the information. And you do have the ability to print out appointment reminders and add notes to the appointment so that anyone that's looking at that appointment, they'd be able to see pertinent information that is necessary for that appointment. As far as rescheduling appointments, same thing. You can do that two different ways. You can click, drag, and drop appointments to different days or times and resources, or you can do a cut and paste. And the system will bring over all of the information for you when you either click, drag, and drop that appointment or cut and paste it. As far as from the front desk doing the check-in and check-out process, right from the patient's appointment, you can right-click on the appointment and launch their chart from here and review all of their information and make updates if and when necessary. So if you needed to collect a copayment and enter that copayment in the patient's chart, you could do all that right from here. And then because I launched the patient's chart from the schedule, once I'm done and I'm completed with the patient's chart, if I X out of it, it's going to bring me right back to the schedule, so I can now change the status of this patient's appointment to checked in. And you'll see here under the status drop-down, this is where you check in an appointment, check out an appointment, mark a patient no-showed, or even canceled appointment. So you can do 4 different actions with the same drop-down. You also can access the patient registration screen from here, and even print out a patient information sheet to give to the patient when they check in to make sure that nothing has changed. So again, a front desk person really wouldn't have to leave the front desk area or even the appointment screen at all throughout the day. So as far as the billing goes, once the provider signs off on that patient's chart in AC, and that billing information comes over to the PM, the biller can do a review process prior to claim transmission to make sure they're sending out a clean claim. And the charge processing screen is pretty straightforward. Tells you everything that you need. And of course, the biller would know if and when additional claim information is required. We also allow for manual charge entry. So if you had to manually enter a charge for a patient, you can do that right from their chart. And then just a click of a few buttons, the biller would be able to batch up the claims and transmit them to the clearinghouse for further processing. And all that is done in the billing area of the system. So front desk is where your front desk activities take place, and billing is where your billing takes place. So the batching of your claims, and there's a lot of different checks and balances in place for the biller to ensure that they are, in fact, batching the claims that they want to batch and sending to the clearinghouse. And all the claims get validated a few different times during the claims process. They get validated before they leave ACPM. They get validated once the batch arrives at the clearinghouse. And then they also get validated when they get to the payer. When a claim batch is transmitted out of Amazing Charts Practice Management and goes to the clearinghouse, unlike other systems, because we work so closely with our clearinghouse, they provide all of our users access to the clearinghouse so that once you actually transmit your batch within just a few moments, you could log into the clearinghouse portal and see the claim status of that batch. So see whether or not your claims were forwarded to the payer, or were there any errors once the clearinghouse scrubbed the batch. So I'm just going to show you now briefly what that clearinghouse looks like. So you can see where you'd be able to easily manage your claims from the clearinghouse. And Adam mentioned earlier that the clearinghouse we use is Claim Remedy. So after you're done transmitting your batch, if I go into my clearinghouse portal, I'll be able to see the batch that was transmitted, and the status of that batch. So here's a quick view of what our clearinghouse portal looks like. See, it's pretty colorful. Here's my claim batch that I sent from Amazing Charts Practice Management. It stamps it with an upload date and time. And it tells you whether your claim batch was successfully forwarded to the payer for further processing. Or if there were any errors in that batch, they would show up in the error column, and you'd be able to view the errors and make the corrections to those errors. And the clearinghouse does allow you to correct certain errors right within the clearinghouse if you wish to do so. And then you can run different reports in the clearinghouse portal. So if you wanted to see and run your forward to payer report, you can click on the number in the corresponding column, and you'll get a nice little report that you could save or print. In addition to your claim batches, you can also view claim status. So if you were following up on a particular claim and you wanted to know what the status of a claim was for a particular patient, you'll see here on my next screen that there are a lot of different filter options. I could actually look up a claim for a particular patient and see the status of their claim. And you can see that not only will it show you if a claim was forwarded to a payer, it will tell you if it was adjudicated. And if it was adjudicated, it would tell you, was it paid or was it denied? And these links here are direct links into the EOB. So you could see what was paid and you could see what was denied. So you don't have to wait to get reports back in your practice management system to see if claims were forwarded or what the status of claims are. A lot of other practice management systems, you have to wait 24 to 48 hours to get that information. Because you have your own login to the clearinghouse, you can see all that information right from here. And again, you can run different reports to see all your denials or your claims in certain statuses. So of course, once your payers receive your claim batches, they send back an acknowledgement report. All of your acknowledgement reports are available either in ACPM or in the clearinghouse, because those acknowledgement reports have to filter through the clearinghouse before they get into the practice management. So it's really up to you whether you want to view those reports from the practice management, and those reports come in under the billing section, manage claim reports, or you can do it right from within the clearinghouse. Once the payer, of course, adjudicates your claims, all of your electronic remittances are going to come into the practice management under the bookkeeping area. So the bookkeeping area is where you're going to manage electronic remittance advices. So those are electronic EOBs that payers will send once they adjudicated a claim, and we always recommend that you sign up for as many ERAs as possible. And you will get a dedicated claim remedy representative that would help you not only with your claim enrollment, but also your ERA enrollment for all those payers that you participate with. So whoever's doing the payment posting would be able to manage all of those ERAs from here. Or, of course, if you have payers that do not send ERAs and you're still doing those payments manually, that is done on the screen here. And in just a matter of a few clicks, you can download an ERA and then commit it to the system. So a large check that you may have entered in manually and took an hour because all of the line items and having to put in what the allowed amount is, what the payment amount is, co-insurance, manager transfers, all that can be done in just a couple of clicks with the electronic remittances. You can also set up charge preferences in bookkeeping. So if you do have any manual charges that you have to enter in the system for your providers, and let's say you have a stack of encounters from a hospital for a particular provider on a given date of service, you can set up defaults so that when you enter in those manual charges, it will automatically default to a particular location, provider, and date of service. You can also manage patient and practice payments from here. And you can manage your payments in a lot of different ways. So you can decide whether you want to look at all patients that have just unapplied balances or patients that have unapplied balances but also balances out to self-pay. And you could apply them by bulk here. You can edit payments from here. You can view your accounts receivable for your patients from the bookkeeping screen, and even manage end-of-day closings. And then, of course, there's a reporting. So the reporting link is just that. It's where all of the practice management reports are located. And depending on the type of report you run, each report has its own set of filter options to help you customize that report for your needs. And reports can be saved in the system so that if you want to know next month how you ran a report, you can save it. And in addition to the reports that are available to you in the practice management, there are additional reports available right in the clearinghouse. So there's a plethora of reports between practice management and the clearinghouse that you can take advantage of. And then finally, when it comes to patient statements, there are two ways that you can manage statements in the system. You can batch up your own statements in the billing area. And when you batch up those statements, of course, you'd be able to review the statement batch prior to printing it. Or you can have a third-party vendor, BillFlash, do all of the managing of your statements for you. So there is an additional fee with the BillFlash statements, but we have a lot of clients using BillFlash because after, as far as the amount of time it takes you to print those statements, the paper, the ink, the envelopes, the postage, it really ends up working out to your benefit to have BillFlash send your statements for you. And that's something that, you can obviously learn more about during the sales process. But all of those BillFlash statements, you would be able to manage those in the clearinghouse as well, because BillFlash works with the clearinghouse. So you wouldn't have to go to another site to actually go in and manage your statements, there is a link right in the clearinghouse that you would be able to use to drill in and view your statements that Bill Flash is sending on your behalf. So that is our demo on Amazing Charts Practice Management. What I'm going to do now is I'm just going to open up the floor to any questions that you all have. Of course, like Adam said at the beginning of today's session, if you would like a more deep dive or customized demo for your practice, please don't hesitate to reach out to our sales department, and I will put that number up for you in a moment so that if you don't have our sales department number, you can write that down. You will also get a follow-up email after today with the recorded version of the demonstration and some additional contact information. So we had a few questions come in. Someone asked, what is the cost for the practice management support? Great question. Your practice management support is already rolled in to the monthly payment, so there is no additional cost for practice management support. Same goes for any clearinghouse fees. A lot of practice managements or clearinghouses will charge you fees for, depending on how many claims that you are sending or eligibility checks that you're doing or electronic remittances that you have come into the system. All of that is rolled in to your monthly payment. Another question is, are demographics entered only once for both PM and EMR? When you enter in a patient's information in the PM, that information will automatically update in the EMR. How will support work? Will we be able to call and speak to someone, or will we have to use the chat option like in AC? So the support on the practice management side does work a lot like the support on AC. We try to keep that pretty streamlined. So you'll have the ability to either email our tech support. You'll be able to either call and leave a voicemail receptionist, and she would log a ticket on your behalf, or you can use the chat option. Now, like Adam said in the beginning, during your implementation process, you will have an assigned practice management implementation specialist and trainer that would work with you during your implementation and even for a certain amount of time after your go live. And then after that, once we feel that you are ready to be transitioned to our support, you'd be transitioned, and then any further questions that come up, you'd be able to use one of those methods to get your questions answered. Does the billing data automatically transfer from EMR to PM? Yes. So like you saw what I did a few minutes ago, when the provider is signing off on the patient's encounter and they check off, the level of the visit and maybe some additional CPT codes, once they click that sign-off button, Amazing Charts automatically takes the details of that patient's visit and moves it over to ACPM for the biller to manage it there. Another question was, what is the cost of Bill Flash? It is not a flat fee. It is going to be based off of usage. So that's another nice thing, is that if you don't use the statement, electronic statements, you don't get charged. And then the fee per statement does depend on the level of service you purchase. So that's something that you would discuss with the sales department at the time of purchase. So someone asked, I'm currently using AC for my EHR and MedEffects for my PM. Will I have to complete new ERA forms with all of my payers since MedEffects uses a different clearinghouse? Yes, you would still need to go through the enrollment process with Claim Remedy. But like I mentioned a little bit before, a little earlier, that during your implementation process, you do get an assigned dedicated Claim Remedy representative that would hold your hand through that enrollment process. So it would be a pretty streamlined, straightforward process to move you over from one clearinghouse to another. And that's really when you go to any new practice management system that uses a different clearinghouse. All fantastic questions. So are there any other questions? Going once, going twice? Of course, if you do have any questions that come up after today, please don't hesitate to reach out to us, whether it be the sales department, and I'll put that number back up here for you in case you didn't get that during Adam's piece. It's right down here at the bottom. Or you will get a follow-up email with my email address. Please don't hesitate to reach out to me with any questions. All right, well, thank you again, everyone, for joining today. You will all have a copy of this demo sent to you, I would probably say, in the next couple of days. So keep an eye out for that. Adam and I appreciate all your time today, and I hope everyone has a wonderful afternoon and rest of the week.
Thanks, guys.
Take care, everyone.